Okay, thank you so much for joining us, everyone. Welcome to our Heart Talks webinar. I'm Samantha Bort, the Senior Manager of Programs and Hospital Partnerships here at WomenHeart. So to those of you who are new to us, we are a patient-centered organization that provides support, education, and advocacy to women living with or at risk of heart disease. So I really want to thank you all for joining us. But before we get started, I would like to thank Jazz Pharmaceuticals, our sponsor for today's webinar. So we are here today to talk about sleep. Based on years of research and evidence, we now understand how important sleep is to our heart health. So much so that earlier this year, the American Heart Association added sleep as an element of heart healthy living, going from Life's Simple 7 to Life's Essential 8. So here to talk to us more about that and the impact of sleep on our health is Dr. Michael Grandner. He is a clinical psychologist and director of the Sleep and Health Research Program at the University of Arizona. Thank you for being with us, Dr. Grandner.
Hi, thanks for having me here. I'm going to share some slides. I promise not too many. So I wanted to talk a little bit about sleep and heart health. So this is where I'd like to start. So we had the special issue of Science came out recently that was focused on sleep. And this is a quote from a paper we had in that issue about why is sleep important and how does it work and how do we wrap our heads around it. And sleep is a non-negotiable biological state required for the maintenance of human life. Our need for sleep parallels that for air, food, and water. When you think about it, what are the other non-negotiable biological requirements for human life? We need to breathe air, we need to drink water, we need to eat food, an argument could be made for shelter. That's pretty much it. But nobody says things like, breathing unpolluted air, that's a luxury for people with too much free time on their hands. Like, who's got time to breathe unpolluted air? Seriously, like, you must be lazy to breathe unpolluted air. And people don't say, you know what, when I retire, I'm going to have the time to get a roof over my head. I'll sleep on the street, as long as I can. But then, maybe once I retire, I'll get a home, like, or I'll eat healthy food. Like, no one says that, because it would sound ridiculous. But we do say all of those things about sleep, and that's because we live in a society that devalues sleep. Not because sleep is unimportant, but because it conflicts with some of our societal values. Because we tend to see sleep as an unproductive use of time, which it's not. But because we see it that way, we have all these pressures to sort of devalue sleep. And that sort of created the situation we're in right now. So there's a problem in the population. So I'm going to talk just for a few minutes, just a brief, super brief overview about what's out there. So first of all, insufficient sleep duration is highly prevalent in the population, and it's associated with a lot of outcomes that people care about in terms of impaired daytime performance, but also obesity, hypertension, diabetes, poor mental health, inflammation, and mortality. Here's some data from a few 100,000 US adults showing that about half are getting 7 to 8 hours of sleep, but a solid third of them are not. They're getting that 6 hours or fewer, which is what's associated with these outcomes. I'll show you some of that in a little bit. But again, to keep things at the 30,000 foot level, poor sleep health, and there's tons of data to support the importance of poor sleep health. So poor sleep health can lead to things like lost full and partial days at work, decreased productivity and efficiency. And I put these first because people think that sleeping less makes them more efficient and get more done, when actually the opposite is true. You become less efficient and end up getting less done at the end of the day. Poor decision-making, memory problems, depression, anxiety, risk of suicide, and poor sleep quality triples suicide risk. Weight gain, heart disease, and diabetes. I'm going to talk about this a little more in a minute. But also things like car crashes, accidents, injuries, and errors, getting sick more often and requiring more time for recovery. Decreased work-life balance, increased stress, increased alcohol, smoking, and other substance use. and even a shorter lifespan. Actually, we are the data showing that people who have poor sleep health don't live as long. Goes back to the earliest study was in 1964. I mean, there's dozens and dozens and dozens of studies now showing that sleep is related to longevity. And why is that? Because sleep is related to a whole wide range of health outcomes because it's foundational. So you have all kinds of studies linking sleep with metabolic health, cardiovascular health, immunologic health, mental health, behavioral health, and cognitive health. And all of these are all interrelated with each other. I just want to talk a little bit about sleep in women, only because of some of the people interested in this presentation. A few things to note. Insomnia it occurs in women about 1.4 times the rate or more than men, so more than double. Restless legs is about twice as common in women as men. Sleep-related headaches are about 4 times as common in women than men. About 80% of fibromyalgia cases are in women, which is a severe sleep disruptor. Nocturnal sleep-related eating disorders are 65% women. Nightmares are more common in women. Familial sleep paralysis is more common in women. But women do have less obstructive sleep apnea and snoring than men do. They also have less delayed sleep phase than men do. Here's an illustration of what happens to circadian rhythms over the lifespan. So here you can see age. This is data from Till Renneberg's lab showing that you see kids. So the y-axis is chronotype. This is how earlier of like a morning person or a night owl you are. So low is more of an early person. You can see kids. Kids wake up early. That's pretty normal. But then as they become teenagers, their biological night shifts later and later and later and later, which peaks in the early 20s. And then it starts shifting earlier and earlier. And you can see that shift is a little less pronounced in women than men. Women tend to be more likely to be earlier people versus later people. But again, this is dynamic and changes across the lifespan, and gender differences tend to go away in the 40s, it looks like. A little bit about population level sleep disturbance and fatigue. So this is data where we looked at over 150,000 US adults, asking them how many nights a week do they have problems with their sleep. And what you could see is you have men and you have women here. This is just the raw numbers. And what you can see is, depending on the age, about a fifth to a quarter of women are saying that they're having sleep problems at least 3 nights a week, which is usually what we consider clinically relevant. In men, it's a little less, but a couple of interesting patterns you could see here. It's not that as people get older, sleep is automatically worse. So this is interesting. As we get older, sleep might get more fragmented and more shallow, but in terms of it being a problem, that actually decreases with age. You can see that the age group for which women report the highest rates of general sleep disturbance is 18 to 24-year-olds. Even if objectively their sleep is maybe the best in their adult life, subjectively it's not. And then you can see between ages about 40 and 60, you see an increase in sleep disturbance that then drops. And you can see the lowest reports of sleep disturbance in women are actually in the oldest women. They might have more shallow sleep, but it looks like it's impacting them less. It's less subjectively a problem. Fatigue, sort of a similar pattern, where you could see women also report more fatigue than men, but it actually declines with age until you hit about age 70, and then it starts going up again. No age group of women was more likely to report daytime fatigue than the 18 to 24-year-olds. And so when we statistically adjust for things like access to healthcare, depressed mood, overall health, things like that, actually that rise in fatigue after age 70 actually totally disappears as well, where that's not aging, that's illness and health and other issues. And if anything, the trend for a decrease becomes even more pronounced. So the take-home messages here are that, number one, yes, women do report more general sleep disturbance and daytime fatigue than men do. It changes across the lifespan, but it's not necessarily the pattern that everyone thinks. And we've been able to replicate this with other variables like how many nights a week are you not getting enough sleep? Similar pattern. What's the difference between how much sleep you get and how much sleep you think you need? Chart that over age group, similar pattern. You start seeing these patterns with age that actually it's not always bad news. So a little bit about sleep and overall health. Here's some data also from a large national sample showing that normal sleep of 7 to 8 hours is associated with the lowest risk of being obese, having high blood pressure, and having diabetes. And you can see that they sort of are tracking together, that the short sleepers getting 5 or 6 hours are about 20 to 30% more likely to have these conditions. And the very short sleepers, the ones getting less than 5 hours, are a lot more likely to also be obese, have high blood pressure, also be diabetic. The long sleepers too, 9, 10 and more hours per night, is also associated with some elevated risk, though not the same as short sleep. But this is cross-sectional. When you follow people over time, what you see is that the people who are getting 6 hours of sleep or less are 55% more likely to become obese if they weren't before. They're more than 20% more likely to develop high blood pressure, and they're more than 30% more likely to develop type 2 diabetes compared to before. Weight management is especially sensitive to sleep, it seems. People who aren't getting enough sleep are more likely to gain weight over time. They're more likely to gain weight faster over time, and they're more likely to have difficulty losing weight. And especially in terms of inflammation and hormone systems, especially, which are closely tied to cardiometabolic health and women's health, lack of sleep increases inflammation, but also, especially in women, longer sleep, the 9, 10 plus hours sleep seems, especially in women, to be associated with elevated inflammation and other stroke risk factors. And lots of hormone systems that regulate a lot of body functions rely on sleep for regulatory process. So pretty much any endocrine system is tied to sleep in some way. Most of them are. But again, this age phenomenon is interesting. So here's some data where we looked at about over 700,000 adults. And these are just the p-values of the relationships showing how much sleep people are getting, how much is overlapping with hypertension. And what you can see is short sleep is reliably paired with hypertension until you hit the older age groups, where all of a sudden it doesn't really seem to be as much anymore. Again, this declining power of sleep over heart health actually is sort of good news with age. You know, we often don't hear about some of the benefits of aging, in addition to things like gaining perspective and being more resilient and having coping skills. Actually, the relationship between sleep and heart health actually gets somewhat weaker with age. It makes sense. If you've got high blood pressure as a 70-year-old, how you're sleeping right now probably isn't the main driver of that. It might be contributing, but it's not the main reason why you are. So that's good news. And we also see the same thing with sleep deprivation, by the way, that in sleep deprivation studies, the older you are, the more resilient you actually are to sleep loss in terms of cognitive function. You might have more age-related cognitive problems, but sleep impacts those a little bit less. In terms of other sleep issues, sleep apnea is a major public health issue. This is data from Peppard et al. From 2013. This is still the best population level data that I could find on prevalence of sleep apnea. And when you can see it's more common in men than in women, but look how closely it's tied to body mass index, where as you look at women, even age 30 to 49, people who are in just the overweight category of 25 to 30, 4% are estimated to have at least mild sleep apnea. So that's 4%. That's 1 out of what, 25 women. So this is think of a room of that many women in the room with at least one of them having sleep apnea, and these are people who are not obese. Once you're obese, it goes up, and once you become morbidly obese, it's a coin flip or more, especially over age 50. I'm leaving this slide on there and rambling over it for a minute or so, just so that people can really see these numbers. It is shockingly common, and it's underdiagnosed in women and related to heart health. So sleep apnea is related to heart health through a number of different pathways in terms of the upper airway obstruction, cortical activation. You have increased sympathetic tone. It puts a stress on the heart every time you have these respiratory events. It causes systemic oxidative stress, causes sleep fragmentation. All of these different pathways are why pretty much any cardiometabolic outcome you look for is worse in sleep apnea. I mean, go into a diabetes clinic There's a few studies that have gone into diabetes clinics, just screened everyone for sleep apnea. The rates that they found ranged, the lowest was about 65, 70%. The highest was, over 85% of the patients just consecutively showing up at a diabetes clinic positive for sleep apnea. So sleep apnea is a major cardiovascular health issue and underdiagnosed in women, especially. A little bit about insomnia. Insomnia is difficulty falling or staying asleep. Here's some population level data on the right about just poor sleep quality because they didn't have insomnia diagnosis, showing that people who have just difficulty sleeping are more likely to be obese, have diabetes, have had a heart attack, had a stroke, have heart disease, even after adjusting for covariates and even just overall health, where the poor sleep isn't just a marker of poor health. The poor sleep itself seems to be related. It's associated with weight gain and obesity. People with poor sleep health, poor sleep quality and insomnia symptoms have a 35% decreased likelihood of successful weight loss. They have a 20% increased likelihood of having high blood pressure, not just short sleep duration, but insomnia as well, and also associated with more than doubling of an increased likelihood of developing uncontrolled HbA1c. So insomnia itself is also a cardiovascular risk factor. And that's why, the American Heart Association, reevaluated the Simple Seven and added sleep into the Essential Eight. It's part of what heart health is, alongside physical activity, weight, lipids, blood pressure, etc. The image on the right is also from the Essential Eight paper, showing that it's not even just the Essential Eight. Psychological health is also a contextual factor that determines all of these things and all of these things within. And then also you have social determinants of health, like socioeconomics and neighborhood and environmental factors that also exist in the background of all of this stuff. So thank you very much. I tried to do this as quickly as I could and leave some time for questions. And here's my contact information if anyone has questions. So thanks.
Thank you so much, Dr. Grandner. That's useful information, right? Being aware of first, like the risk associated with the lack of sleep and, low quality of sleep, but then also figuring out more about what does it usually look like for people.
Yeah.
Okay, well, before we continue on, I just want to remind everyone to please type any questions you have for our panelists by clicking the Q&A button on your screen. And now I would like to introduce our second expert speaker, Dr. Courtney Jordan Baechler. She is a cardiologist and the medical director of the Emerging Science Centers at the Minneapolis Heart Institute Foundation. She is also a member of WomenHeart's board of directors and our scientific advisory council. Thanks for being here, Dr. Jordan Baechler.
Thank you so much. I'm so glad to be here. And that was amazing, Dr. Grandner. Thank you so much for your expertise. I can't emphasize as a cardiologist how much my sleep practice has changed both personally and also in terms of what I do with my patients because of the very data that you just discussed. I would just say from a personal perspective that I used to be somebody that I think is a challenge with much of our society that really prided themselves in, I don't need as much sleep. That's how we got through residency and fellowship. I'm going to do these 6 a.m. workouts and, high intensity interval training. Couldn't probably be worse for all of these outcomes. And now I really have personally changed that emphasizing the sleep again for myself and for my patients. So excited to, some of this will be just a little bit duplicative. We'll go to the next slide, but just knowing that I'm coming from that cardiovascular lens. I don't have all the expertise that Dr. Grandner has in sleep, but as you heard, what do we know about sleep deprivation and just poor quality sleep, as you alluded to? If we get too much sleep and it's not quality, what do we see? We see the very risk factors for developing heart disease and worsening existing heart disease. So we see increases in blood pressure, increases in weight gain, increases in heart rate, those cortisol levels, which really increase our inflammation and our ability to control our blood sugar. And then obviously this kind of chicken and egg thing that we're going to talk about, when you have all those things going on and you're not feeling like you got a good night's sleep, you're less likely to be able to do life simple 8 or 7 as it was before, in terms of making those really difficult decisions in an environment with lots of calories, kind of making us not move our bodies as much as we want to. We can go to the next slide here. So again, those risk factors that we talked about on that first slide then lead to the development of kind of our first round of diseases with the heart: high blood pressure, coronary artery disease or blockages, plaque in the arteries, atrial fibrillation, diabetes, congestive heart failure, increased risk of all the various heart rhythm disturbances. So not just the atrial fibrillation, but also supraventricular tachycardia, et cetera. And then ultimately stroke, as we heard from. So again, this piece being, we know that it increases those primary risk factors that were on the other slide, then it increases the development of disease, and then ultimately harder endpoints or secondary disease and increased events after those initial events. Next slide, please. And so again, we see this cyclical pattern that I was mentioning. We know that heart problems, once we have established heart disease, we know that that influences having poor sleep or less quality sleep. And then we know at the beginning that having poor sleep or inadequate sleep leads to heart problems. And so I can't emphasize enough that if you take nothing away from probably both of our presentations, having conversations dedicated to sleep about your health with your clinicians is really critical in thriving at any stage of overall health. Next slide, please. So you saw this from Dr. Grandner's presentation, but we know that there's really this ideal amount of sleep between that 7 and 8 hour window for most people in most times of their life, not throughout every age category, but you can see here that looking at people who died after 20 years, healthy people in blue, those with hypertension or diabetes in orange, and those with heart disease or stroke, both when you sleep less than 6 hours, and in this case, this study was one of those that emphasized that 7 to 8, that actually having 9 or more hours can also be a very poor sign in terms of increasing your risk of death for both heart disease and stroke. Next slide, please. So we talked about obstructive sleep apnea. And so again, I would emphasize that anybody I see for sure with atrial fibrillation, I always recommend a sleep study and finding out if they have obstructive sleep apnea, because it is so underdiagnosed, as we heard before. I would, again, my own practice is changing quite a bit because I do think it's so critical that we do this earlier in patients, ideally before they've developed heart disease, definitely once they have developed any at all, that it's really a critical piece. It is a challenge, and I hope that that is one of the things that we're able to do as WomenHeart. Oftentimes in most of our studies, we see women are less often referred for these studies. They're often less likely to actually then have the study done, even if they do get a referral. And so how do we kind of change what we're doing this way? I think the devices have gotten so much better. This is definitely a hot area of research, and you can see why. I can't tell you how many people I see as referrals that come in with difficult to control high blood pressure, and they may or may not have an existing other heart issue, blockage in their arteries, atrial fibrillation, et cetera. But if we don't, it's nearly impossible to control somebody's blood pressure well if they have untreated obstructive sleep apnea. And you can see here that cycle that we're talking about. So increases your risk of atrial fibrillation. So when we see somebody who has poorly controlled atrial fibrillation, that's often the first thing that we need to do, is to get a sleep study, diagnose sleep apnea, and ultimately get people on CPAP. It increases your blood pressure. It increases weight gain. So I have folks, again, who come in and say, I have swelling in my legs. I can't get rid of the swelling. It's driving me nuts. It is oftentimes because of these risk factors beforehand that we're not getting the blood pressure controlled because there is untreated sleep apnea. Really increases the pressure on the heart. And the way that does this, I have another slide on this, but is through the right side of the heart. So we, as cardiologists, we often really focus on that left. I'm sorry, I'm going to go back to that other slide. I'm not quite ready to switch, if you don't mind. Thank you. But we often focus more so on the left side of the heart. That's the one that we see more commonly associated when we have blockages in our arteries and have heart failure. But of course, the heart works together with the right side of the heart, where it's perfusing the lungs. And when we see high pressures in the right side of the heart, it's almost, we call that pulmonary hypertension. And most commonly we see that because of untreated obstructive sleep apnea. And this ultimately causes heart enlargement. It leads to more inflammation. And again, it just continues to cycle. So I love that acronym HEARTS, things that you should think of: heart failure, and elevated blood pressures, atrial fibrillation, resistant hypertension, type 2 diabetes, and stroke, because those are all things that we're increasing your risk of and worsening if they already exist when you have sleep apnea untreated. Now we can go to the next slide. Thank you so much. So, question for many of our listeners on this, many of our champions, our survivors, you women that we are here for every day. Does sleep matter if you have heart disease? Yes, 100%. Again, I think as women, as moms, as sandwich generation, as folks taking care of other family members, this is like a pride for us. We don't need much sleep. We're so busy doing all these things. And as you heard from Dr. Grandner also, we don't have the opportunity not to value our sleep. We absolutely, no matter what our role is in society, if we want to be there, to be all these wonderful things to folks in our lives, we have to take care of ourselves first. And that absolutely comes with taking care of our sleep and getting help if we're not getting therapeutic sleep. And so, yes, for me, this is a critical piece of the puzzle that I am always speaking to my patients about, just as much as we talk about nutrition, medications, whatever the next step is. This is huge. Next slide, please. So I want to just emphasize here, this is a slide of the chicken and egg piece of mental health, as we also heard about. And that, again, there's this association with mental health causing heart disease worsening our mental health, and which causes what. I would emphasize that, again, this is critical with sleep. We see worsening mental health outcomes, as you heard, and this is also tied together. I do hope that we see the AHA's 8 become 9 with mental health there, because we can't be not thinking about this as we're looking at how it's all so very interconnected. Next slide, please. So just a little bit about heart failure, because this is kind of its own little beast, in that we know that heart failure worsens your sleep. And again, sleep, if it's not great, can worsen heart failure outcomes. And some of that is because of the symptoms that are very common when you have congestive heart failure. So it's not uncommon to wake up having shortness of breath. And so we call that paroxysmal nocturnal dyspnea is our medical term for that. But what that means is that it's more common when people are sleeping and have a heart that doesn't function ideal to wake up feeling short of breath, We also know that it's often more difficult for heart failure patients to lie flat because, again, of the overall function of their heart, sometimes having to sleep on more pillows or to be propped up. It's more common to have a cough at night when you have heart failure. And we know, again, back to the mental health challenges, that folks with heart failure often have a decreased quality of life, and this can worsen your sleep that way. Again, leading to fatigue, anxiety, and overall cognitive or not optimal function of our brain. So we really want to be looking through that lens of how do we optimize your heart failure? How do we optimize your sleep? How do we optimize your mental health? All these pieces so that we can get these little circles working well together. Next slide, please. So this is a very much a medical illustration, and I think you saw a better illustration of this with Dr. Grandner's slides. But just all I wanted to put this out there is this is the complexity of how disordered breathing and heart failure relate together. And what's so fascinating is so many of the medicines that we use to treat heart failure, like angiotensin receptor blockers or ACE inhibitors, have to do with blocking these various systems, beta blockers, things that we are trying to reduce the afterload of the heart, trying to reduce the overall work of the heart, the pressures, etc. So obviously, I guess in my opinion, obviously, it is so critical that we do what we can with sleep. And again, address sleep, giving it the importance it needs to help you function ideally. Next slide, please. Lastly, I just want to say a little bit about symptoms of heart attack, because we know that women on the right side of this slide are more likely to have the atypical symptoms when they have a heart attack. So some of those atypical symptoms are listed here: dizziness, pain in the shoulder, shortness of breath, sometimes indigestion, nausea, or gas-like pain. And then finally, you see here, unexplained fatigue and sleep disturbances. So I often joke when I give presentations like this to say most of us have had one of those symptoms in the last 7 days, but I would emphasize, I think as women, we know our bodies very well, and always better to err on the side of caution. And so in this case, if you are having unexplained fatigue or sleep disturbances, of which I've definitely seen in my patients before they're having a heart attack or being diagnosed with blockages in their arteries, we want to know, we want to evaluate that. So don't just dismiss this. Let's get to the bottom of it. And perhaps if it isn't significant blockages in your heart, then we can get you to a sleep specialist and be really addressing how we better address this long-term for you. Next slide. So I just wanted to really quickly put this up in terms of sleep aids, because this can also be very confusing. Lots of over-the-counter things do have some interactions for our heart patients, ZzzQuil being one of those. Any one of those with often an active ingredient of Benadryl can increase your heart rate. So folks dealing with atrial fibrillation or any type of our rhythms that we're looking to lower the heart rate, which is many, sometimes that's not ideal for your heart. And so we would defer you to try to not be using those in general. Unisom, again, can cause some drowsiness because of this antihistamine, something that you want to think about, because if you're already dealing with daytime sleepiness from your heart conditions, might not be something you want to use. Melatonin does appear to be mostly safe. We do see an Ambien. There's some association with heart palpitations. Lots of some conditions between sleeping pills that look to increase potential development of high blood pressure, some of the over-the-counter ones. And then the ones that we overall see to be most safe with heart patients are things like mirtazapine, trazodone. What I would emphasize is, again, just like you have a cardiologist, I would strongly encourage many folks to have a consultation with a sleep medicine specialist. Medicine has gotten so specialized, and while I appreciate that oftentimes folks don't want to add an additional consultant or visit, I think it's at least worth a consultation. That's what I would do for my own family member, to have someone look through the lens of how best do I go about treating my sleep regime. Next slide, please. So this is just, I think, a nice peaceful picture. And if you, again, take away one thing from my portion here, sleep matters. It matters before you have heart disease. It matters with heart disease. It matters throughout the whole course. And I think it's just an area that we need to have more conversation and education about. So thanks for having me.
Thank you so much, Dr. Baechler. That was great and useful information. And, particularly the sleep aid slide, I think is an important conversation to have, right? And And I can just anticipate potentially some questions about that. But, it's something that I think is at the top of people's mind when they think about sleep. So I would like to now bring our WomenHeart champion, Lori Wood, into the discussion. Lori is from Bentonville, Arkansas, and she became a WomenHeart champion in 2017. A little bit about her heart story. Despite having no risk factors and living a healthy life, you were diagnosed with heart failure in 2015 and have been managing your disease ever since. So thanks for being here to talk about the role of sleep and rest in the course of your heart journey. I appreciate it.
Of course.
Lori, let me start with the first question, really, to get this discussion going. Would you mind telling us a bit about your relationship to sleep before being diagnosed? Were you a good sleeper? Did you get all the recommended sleep? What did that look like before?
Sure. I think both of the doctors kind of touched on this, but especially I feel like as women, we fight our own expectations sometimes. And for me, as a young mom, I thought the best moms go to bed at midnight and get up at 5 a.m. so they can do all the things and volunteer and serve and just be everywhere they need to be. And because the worst thing I could think of was to be considered to be lazy. And I really had to relearn some things. One of those is that, whether you have heart failure or not, or any kind of heart disease or not, the best version of ourselves is never an exhausted one. My daughter became a mother this last year, and I can see her and people her age are being more aware of sleep and being more respectful of rest. And so I'm hopeful that things are going to be a little bit different going forward. But no, for me and for most people my age, I think I did not value sleep.
Yeah. So it sounds like, we talked about it, right? The societal view of sleep and the other associations of it as, oh, I'm just being lazy. I don't need that. I need to, take care of my kids and work. So how did that change then for you? What is it that you've done now to prioritize your sleep, to change your habits?
Yeah. So was already mentioned, but heart failure and the drugs that treat heart failure both cause fatigue. And so it's something that, whether or not you've dealt with it in the past or realize that it's important, it becomes important. It becomes really important. But heart failure itself can make sleep more difficult. And this was already touched on as well. For me, it was a constant cough, which I had for years, had no idea what that was. But in sleep position, for example, I was always a stomach sleeper. And when I got my device installed, it's just under the skin on my left chest up here, I couldn't really sleep on my stomach. It just wasn't comfortable. And so I had to figure out a different way to sleep. And the diuretics that you're taking keep you up and down to the bathroom all night. And the shortness of breath lying down is a real thing. You can feel like you're drowning sometimes when you're lying too flat, and then you're adjusting your pillows. And so there's just a lot going on there. But I learned right away that my sleep was just as important as my medication and my low sodium diet and exercise. It was just one of those huge things that had to happen. And, I mentioned my own expectations earlier. And I have to mention this because I think this is a huge problem for people, is that other people's expectations sometimes cause problems for us too. And to be fair, heart disease largely is an invisible illness. Most of what goes on with us and that we're dealing with, people don't see on the outside. And so it's difficult for other people sometimes to understand what's going on with us and to sympathize with how we're feeling. And I think that's especially true of fatigue. I've heard people say, and I know people have thought before, things like, well, you were fine yesterday. You look okay to me. Everyone else your age can do that. I don't know why you can't. We used to do that together. So why can we not do that now? And, you know, we can even be, which we've already talked about is a huge trigger. We can't even be accused of being lazy. And, you know, I read a study in the last few weeks of heart failure patients. And the question was, what's the most difficult part of managing heart failure? And the number one answer was being misunderstood in our need for sleep. And that's kind of heartbreaking, really, because that need is so there, but yet still, because you don't look like you need to be sleeping, you know, this extra amount of time that you shouldn't be.
Yeah. Thank you for that, Lori. So, you know, it sounds like there was a huge change once you were diagnosed, right? I mean, even the discomfort of not being able to sleep the way you used to. How have you prioritized that now? Like, do you have a sleep schedule? What does that look like in your life, I guess, your day to day?
Yeah. Well, definitely for me, it's more sleep at night because I've just never been a napper. Once I'm up and going, I'm going until I'm not going. You know, other people I know like to get up early and then do some things and take a nap. That just never worked for me. But I think what's critical is that whenever a heart patient joins the rest of the world for a few hours or a few days, there has to be something in place to say, okay, I'm going to rest or I'm going to catch up in this way. And it's kind of hard because you're going to miss out on some things. I mean, the truth of the matter is the world goes along at a certain clip and you're going to miss some things that are important to you. My dad was on hospice a couple of years ago, and I just didn't have the stamina to get up with him night after night. And I wanted to so bad. I desperately wanted to be the caretaker and the hero. But I just finally had to realize I couldn't do it. And so I had to learn how to show up for him in different ways. And so all that is to just say, find a way to do it that works in your lifestyle and the things that you also have to balance.
Yeah, so important to figure out what works for you. So do you feel like nowadays sleep has really helped you manage some of that fatigue that we were talking about? Has that made a difference for you?
Yes, for sure. And I think when we talk about, you know, we talk about managing fatigue, I think it's important to know that we're talking about managing it so that we're able to function in a healthy world, at least part of the time. And that applies to your work life and your social life and your family life. For what worked for me is that, like I said, there's days on and then there's days off. And so we have a code word in our house for those recovery days, those days off. It came about, we were vacationing a couple years ago, and it was a long vacation. We were at the end of it, and I was exhausted. And we went to a zoo on the last day of our vacation, and there was a creature there that I really identified with that day. He was moving really slow and he looked sad and draggy, and his fur was like coming off of him, it looked like. And I went over to the display, and the name of that little creature was called a muskox. And apologies to the good-looking muskox out there if there are some, but he looked exactly like I felt that day. And so now when I'm having a bad day or I've had a busy time and then I know I'm going to have a recovery day, all I have to say is it's a muskox day. And everybody knows Mom's not doing anything today. It's a muskox day. And then another really important thing I think for managing fatigue, and both doctors touched on this as well, is that I walk every day. Whether it's outside or on a treadmill. I've even been known to walk around in circles in my house. And the reason I do that is because it really helps manage fatigue. I find that I have more energy when I do that regularly, and I sleep better. I sleep sounder at night when I do go to sleep.
Yeah. Thank you, Lori. I think it was interesting what you just mentioned about being able to communicate to others, right? Today's one of those days where I just need the extra rest. Well, is there, just before we finish up with our conversation here, is there one piece of advice that you would really like to emphasize to other women with heart disease?
Yes. I think one thing that has been really helpful for me is that think about having someone else run interference for you about your sleep needs. And I liken it kind of to having an infant in the house. When that baby's there, there's the mother or the father or caretaker who is making sure that they're getting enough sleep and that it's quiet during nap time and they get quality sleep and they're not up too late. And sometimes as heart patients, that is important to have someone else be watching out for you. I know it helps me sometimes because then I don't feel like the bad guy, and I can, defer to that, because people need reminders. They need frequent reminders that, this heart condition requires this important sleep element, and even friends and family need to hear it again and again, because if you're not living inside a body that's affected by heart failure, you forget. So you have to be bold and advocate for yourself, or find someone, for me, it's my husband, but someone who will be that person that watches out for you and helps you establish your boundaries.
Thank you, Lori. Thank you for sharing your story of how it affected you, how it changed things, and also your valuable advice to others.
Oh, thanks for having me. Appreciate it.
Of course. Now I'd like to bring back our presenters, just so that we can go over some of the questions that we've received. I know some of them are getting answered already, but I just want to make sure that everyone gets to hear, the conversations that are happening. So one of the questions that had come up was about sleep positions and whether some of those are better than others. I'll let one of our experts respond.
Well, there's two answers to that question. Well, the first answer to the question is not really. There's not really data on sleep positions, but the other answer to the question is, you sort of heard the answer from Lori, who said, well, for her, it mattered. There is some data where sleeping on, people who sleep on their stomach are more likely to have, people with sleep apnea tend to do worse on their back because their tongue falls back and they have trouble breathing. And people sleeping on their stomach sometimes have airway stuff too, because if their airway's blocked or their neck is twisted or something. But that's all sort of common sensey sort of stuff. When people say, what is the ideal sleep position? It's the one that's most comfortable for you, the one that will help you sleep through the night. And also, to be totally honest, nobody stays perfectly still all night anyway. People move around during the night, whether you're conscious or not when it happens. So pick a position that's comfortable for you. Sometimes, the heart people might have stuff to say about sleeping on your left side or something like that. But there's not really data. Just do what's comfortable. That's what I would say.
Agree.
Thank you all. And then Dr. Baechler, I know that you already sort of gave a response to this, but I'll just ask it again. Are there any heart medications that could cause sleepiness or insomnia?
Yeah, this is such a hard question, because almost every medication that we put you on can cause some fatigue, sleepiness, can impact your sleep. But I was messaging to the person that wrote that, I really think that is why having a conversation and trying to find this middle, and ideally with 3 people, the patient, most importantly, the cardiologist and a sleep specialist, to kind of figure out the potion, the concoction that's going to work, because sometimes your cardiologist can just see more is better. Basically that's how our algorithms work. The highest amount of a beta blocker, which its goal is to decrease your heart rate, and a side effect of that is often fatigue and potentially insomnia. So sometimes we have to back off of those, despite the fact that it might be ideal for your heart if it's hugely impairing you and how you feel. I think you really got to have a conversation that way. And I think Lori did such a great job of explaining some of those nuances that get lost when we only think about the organs and lose the whole person in the piece of it. So.
Yeah. So, we've heard about aiming for the 7 to 8 hours, right? One of the questions we got was about, what if I'm not able to, right? In this case, someone's asking, what if I have a job that doesn't allow me to do that? What about napping? Where does that come in?
So napping counts. It's not real. It doesn't look like it's exactly a 1-to-1, but all of the 7 to 8 hour sort of guidelines are all based. First of all, they're not based on wearable data. They're based on self-report, which is going to be a little higher than what your wearable is. So I want to get that out of the way. And also, it's out of 24 hours. So if you're taking a nap during the day, that counts toward the 7 to 8 hours. Naps don't. They're sometimes not good for sleep replacement. I mean, so you can do a sleep replacement nap, sort of like a meal replacement shake, where no one's going to mistake it for an actual meal, but it can do some of the work and do some of the replacing. College students do this all the time, where they'll sleep for a couple hours in the afternoon, and that works. Napping is good in that it can help reduce fatigue, improve brain function. You're actually getting some sleep, but if you're napping because you can't stay awake, there's all kinds of data out there showing that people who nap more have worse heart disease and other health outcomes. My guess is that it's not the napping that's the problem. It's people who do, because we live in a society that doesn't support napping very much anyway. For people who are napping a lot, it's usually because they can't stay awake, which usually means there's a problem with their sleep. So I guess the complicated answer to the question is napping's probably good. Napping counts mostly if you're napping a lot, and you might want to ask yourself why. If you're not getting good sleep at night and there's something you can do about it, focus there, but don't be afraid to nap is what I would say.
Thank you, Dr. Grandner. One other question that we had received was about insurance not wanting to cover a sleep study and anything that can be done to change that. And Dr. Baechler, you had mentioned, having those conversations with your primary care doctor, your cardiologist, and really working to get it covered.
Yeah. I that's been my experience. Is there's often, as we listed off, a reason to have a medical reason to have it covered. Obviously, still confusing with high deductibles and things like that, but I think having a conversation with your clinical team to see if they can help in that process.
Yeah, it sounds like there's a little bit of self-advocacy also that needs to happen there to have those conversations. And, you had mentioned that women are less likely to be referred to sleep studies. So bringing that up and having those conversations as well. Mm-hmm. Okay, we received another question about, do you have any information about hyperinsomnia and heart health? I was recently diagnosed with hyperinsomnia after a sleep study.
So hypersomnia. So there's a whole group of hypersomnia disorders, including narcolepsy, but also idiopathic hypersomnia. But these are people who have it's the opposite of insomnia. Instead of people who can't fall asleep, these are people who can't maintain wakefulness, which is a whole other set of, and you can have both, and it's a whole thing. There are a number of studies now that are linking this with other kinds of heart issues. There's not a ton. It's relatively understudied. There's a lot of overlap with sleep apnea. People with narcolepsy might also have an issue where one of probably the most well-studied treatment for narcolepsy actually is a medication that's very, very high in sodium. So there's a new version that's less sodium. So there are some complications there. I mean, yes, there are issues with heart health and hypersomnia disorders that seem to be a little bit different. It's not studied as much, but there does definitely seem to be a link there, potentially because sleep-wake regulation is so connected to so many other aspects of regulation in the body. It would make sense. If you're somebody who has a hypersomnia, I would suggest getting it treated. There are good treatments out there.
Thank you. Thank you for that. And then I think just one other comment on here was someone just, realizing that I've had high cholesterol for a few years, despite my young age and frequent and consistent exercise, but I never really realized, right, how much of an effect sleep could have. So of course, this is extremely important information to share and very eye-opening for many of us. Well, I want to thank you all for spending time with us and for sharing your knowledge and your expertise, and really helping us get better at taking care of ourselves and our wellness. So thanks. And thank you, Lori, so much for sharing your experience and your perspective as well.
Oh,
so
thanks for having me.
Of course. I want to remind everyone that you'll have a survey that'll come up after the webinar ends. Please complete that. It'll help us get the topics that you need, make sure that we're answering the questions that you all have. And thanks again, everyone, for joining.
Thanks.
Thank you.
Bye.